Deuk Spine Institute. We are here in surgery. We're getting ready to broadcast our, I think, fourth surgery of the day. Still have one more to go after this, but this patient traveled to us with two herniated discs, one big one, one small one, C4-5, C5-6, pain in the neck, symptoms in the arm, and he wants them fixed. He was offered fusion. He didn't want the fusion, not by me, but by another surgeon over in Fort Myers. And here he is to get his Deuk laser disc repair. Smart man, found me online. He's here with his brother who's taking care of him, and we're going to get started. I need a little extension of the head, please. So you can first thing we're going to do is we're going to go in through the front, and we're going to place our spinal needle in the discs that we're going to fix. The first disc will probably be the 5-6 shot. 2, 3, 4, 5-6. What do you think, Louise? 5-6? Oh, yeah. Shot? That's 5-6 right there. You agree? I agree. Everybody agree? Right. 2, 3, 4, 5-6. One more shot. All right, so I'm going in. There we are. Shot. Right on the spine. And let's get an AP. Make sure we're in the middle. Somebody asked me, what's your technique? And I show my technique every single time. Shot. That looks good. Lateral. I show my technique with every single surgery because we broadcast these surgeries live from the very beginning. Perfect. All right, shot. So we're inside the disc. 2, 3, 4, 5, 6. Everybody agree? 5, 6? Let's get an AP one more time just to verify our positioning of the spinal needle. This technique is a technique that I developed. The very beginning I did not. I learned from the Koreans, the South Koreans. Dr. Sang-ho Lee and Dr. Gun Choi were my teachers. Some people know those names. They're probably the most famous names in endoscopic spine surgery in the Asia. And they were my teachers. They probably don't even remember teaching me. That's the funny thing. But they taught me many years ago, specifically in 2006. And they taught me the very beginning, placing the needle and getting the tube in. But the rest of the surgery I modified and started doing it my way, which I felt was a better way to do it. And over the years, it's proven to be a better way because our results are better than the Koreans. We actually have the best results in the world for cervical endoscopic surgery and now thoracic. I've been doing thoracic now for, what, 2.5 years? Yeah. A little over 2.5 years. We've done 18 thoracic discs, and we're not going to have any dye there because there's two types of dye we use. One is indigo carmine, which stains the herniation, and the other dye is a contrast dye called omnipaque. And omnipaque is unfortunately in short supply, supposedly. He was scheduled for, this patient was scheduled for a cervical fusion, ACDF, on Monday. Of course, we lose more blood from the injection with the local than we do from the whole surgery, right? All right, so at this point, we are on the right side of his neck. For those of you who just joined us, our patient's face is here under the drapes, and his neck is here. You can see the right side of the neck. It's been sterilely prepped and draped for surgery. His chest is here, legs are down here. He's looking up at the ceiling, but he's got an endotracheal tube in, and he's on a ventilator. He's asleep under general anesthesia. We do these surgeries under general anesthesia for good reason. You can actually see the carotid pulsing right there. Beautiful. You see the respiration variation of the pulse. All right, so we're ready. We've injected local. I'm going to make my incision. And then we're going to get started. I'm using an 11 blade. It's called an 11 blade because it's shaped, I don't know, like a dagger, sort of. That's what an 11 blade looks like. There's different kinds of blades used in surgery. Number 10 blade, number 11 blade, a number 15 blade. But that's an 11. Okay. Shot, we're coming out with the needle, leaving the guide wire in. And you're going to see this is a bloodless surgery. We literally will lose a few drops of blood and that's it. Okay? You lose more blood during a close shave on your face as a man than you would during this surgery. All right, we're going in now with the dilator. You can see the dilator goes down the guide wire. We're going to use our lateral view. Is it getting warmer in here? Huh? Shot? I don't know. Let's just keep on it. Keep an eye on it.
58, you said? Okay.
Yeah, we're okay. It's just a bit uncomfortable for me. All right, so we are at 2, 3, 4, 5, 6. Maybe this patient can help us with our air conditioning problem. He's a contractor, so if you're watching your video tomorrow, you know any good AC people. I'm just kidding. We've got a good company, Coastal Mechanical. But it's hard getting a good AC contractor to work on our air conditioning system. Okay, I'm going to take the guide wire out. We're going to advance this dilator. And people ask me, well, do you make a hole in the disc with the dilator? No. The dilator is literally just spreading open the fibers. Let's get an AP shot. I'm sorry? No. He's got big discs. 2, 3, 4, 5, 6. Looks perfect. Perfect, perfect, perfect. I like perfect. You can see the esophageal temperature probe is way off to the side. So is the endotracheal tube. Why? They're placed perfectly because they're displaced though because I'm pushing it all over and holding it over with this metal stake. Shot. All right, so now I'm getting close to the back of the disc where the tear is that let the herniation out. So my job here is to go in with this tiny tube. Can you see this here, Henry?
Yes.
This tube is what we're going to do the whole surgery through. Let's show our audience, Henry, why people with a herniated disc get pain in their neck, and even that pain can spread from the neck to cause headaches or even pain down the arm. Let's show them in our animated video why herniated discs actually cause symptoms like neck pain, headaches, and arm pain. Shot.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Great. All right, so we've got our tube in position. Can you show them the x-ray picture? Henry, can you cut to the x-ray shot?
Yep.
You see the side profile of the tube?
Yes, we do.
And you can see the end of the tube is at the back of the disc, right where the tear and herniation are. And you can see, well, maybe you can see here with the eye in the sky, I'm covering it up now with the blue towel. but we have the tube going from the outside world, the operating room, down to the back of the disc where the herniation is. We're going to use our laser and our surgical instruments to remove the herniation and clean out that tear. It's a little blurry, so what I'm going to do, you can actually see the laser fiber there at 12 o'clock. I'm going to adjust the focus on the camera to bring it into focus. You can actually see, if you look carefully, as I focused it, you could see all the fibers. There's 5,000 fibers in this fiber optic scope. They're all glued together. And it's the glue, when it starts to separate between the fibers, it gets old from being autoclaved so much. That glue starts to break down and... Oh, we're good. Leave it on. We're just checking, testing you. I'm just joking. That glue starts to break down and loosen up the fibers. This here is part of the herniation. Okay, let's show our audience exactly how the Deuk laser disc repair works. Can you run a video showing them?
Of course.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back. At the bottom of the tube, what you're seeing here is the laser fiber at 12 o'clock, and I have it off right now, but I'm just touching things, and those glistening white strands right there, those are what's called the posterior longitudinal ligament, and this is the herniated disc on top of it. It looks like little pieces of cotton. There's a piece of herniation right there. And you can actually see the herniation going right through a tear in the posterior ligament, and right down there is where the spinal cord is. So we've got to remove this herniation, but you can clearly see the herniation. And this is C5-C6, I believe, yeah. So look at the perforation down there. That's herniation right there, passing through a tear into the epidural space. That is the coolest. You don't even see this with an ACDF, ever. I mean, unless you have the best microscope available. So there's the herniation. I'm going to try to grab it out. It may come out in one piece, it may come out in multiple. But that's the beauty of endoscopic surgery. You can actually see what you're doing. And there's no fusion done. Nah, I don't think I got it. And there's no artificial disc put in. There's no metal. Folks, you don't want metal. Unfortunately, you're all being sold down the river. When you go have a fusion done, the surgeon is basically using you to give you the wrong surgery, because that's the surgery that they're basically being told that they should be promoting. But it's the wrong surgery to do, okay? Endoscopic surgery is the way to go. Now, we've got something down there. I think it's a herniation. I've got to clean things up a little bit before we get a better look at it. There's definitely some herniation up here at the top, just inside the disc, inside the annulus, I should say, of the disc. But those white fibers are the posterior longitudinal ligament. called the PLL. Most spine surgeons know what that means. Some don't. They all should. But you can see that this patient blew out. Oh, there goes a piece of herniation. I think it came right out of there. There's still another piece in there. We're going to get to that in just a minute. That was cool. So we're literally at the back of the disc right here. This is all torn annulus that's inflamed and scarred. And you've got fibers of the posterior ligament right there, those white fibers running left to right. And look at the herniation wanting to come out of there. I'm going to have to cut that fiber with the laser. And underneath it is a piece of herniated disc. So herniations, most herniations are what are called contained, meaning that they're contained by the posterior ligament. This is not a contained herniation. This is a herniation that's gone through the PLL, and it's sitting outside the spinal cord, just above the dura. So I'm cutting the PLL just literally 0.5 millimeter at a time. This is literally amazingly safe instrument to use as long as you know what you're doing. So the herniation is right in there, kind of in the fibers. And the nice thing about the laser is not only does it use a burst of heat, or not heat, but a laser energy, but it also gives a burst of pressure, a pressure wave. And that pressure wave helps me shake loose herniations, as we'll see in just a moment. So a lot of the jiggling you're seeing happening is the pressure wave from the laser acting. All right, so that I think is a herniation right there. Okay, we're going to have to release it a little bit more before it comes out. I've seen these herniations for years as a fusion surgeon. And I used to take them out with a scraper and a microscope. And then you'd have to fuse the disc. But with the endoscopic technology, we don't have to do the fusion part. We can do it all minimally invasive and just take the herniation out without having to fuse the disc. That is the herniation right there. All right. Let's see if I can grab it out. It may be freed up enough to let me grab it. On the other hand, I can't tell. What is it? Yeah, I couldn't quite get it with the grabber just yet. So I'm going to have to play around a little bit more. It's funny because there's people talking badly about laser surgery, yet they say it's dangerous. Well, I'm sorry, but all spine surgery is dangerous. And fusions are far more dangerous than laser surgery, in my opinion. There's a lot more complications with fusions than there are with Deuk laser disc repair. And we've done our fair share of fusions here, haven't we, Luis?
Oh, yeah. Yeah. Sure.
What is it?
Whatever. Yeah.
Just your usual.
Yeah.
What is it?
Was it one, whatever you were? Yeah, the one that I was doing. Now ordering coffee? From Starbucks.
Oh, Starbucks. I like Starbucks.
He's Dr. B. Trick, right? Yeah, he's in here.
Really?
Getting good data.
Wow.
Crystal, whatever.
Honestly,
For me, whatever. Yeah.
I'm okay. Thank you, though. Thank you, though, for me. It's got to be those cookies yesterday that Meta had were amazing.
Those are the best in the world, I thought.
I've never had anything better. Have you ever heard of that place, Crumble?
They have it in Vegas.
Really?
Yeah. That's all they would order at the office.
That's incredible.
The holidays.
Yeah. So you can see this herniation just pressed up against the spinal cord here. Some of this is older, the golden stuff. Some of it is younger, more recent, the bluer stuff. But just probably 5 more minutes here and we'll be done. Now the next disc that we're doing is the 4-5. It's a small herniation. And honestly, I think it's symptomatic. I think it's causing symptoms. If he doesn't, that's a piece of herniation, by the way. If he doesn't get it fixed, he's going to end up still having neck pain, and it will get worse over time. So I think he's doing the right thing in choosing to get it fixed. But it's not as impressive structurally on the MRI as this one. This is far more substantial structurally. Questions from our audience?
No current questions.
So just a reminder, this patient was actually scheduled in Florida to have a fusion done by another doctor, a neurosurgeon, I believe. And the patient somehow found out about us doing this non-fusion surgeries and came here yesterday and said, please don't make me have to have a fusion. I said, you don't. We can fix this with the laser surgery. Came with his brother, his partner in business and friend, and here he is today having his surgery done. So it works. This is the way healthcare really should be. People get fixed quickly, not having to wait around for their insurance to authorize surgery and deny surgery and deny treatment. People should get their medical problems dealt with right away, not have to drag it out and delay it. But that said, since there's no current questions, let's, this is the foramen, by the way. Let's run a video on the Deuk laser disc repair versus the surgery that he would have had in Fort Myers area.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, 2 patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion.
All right, welcome back. I cut it short because you guys got to see this. We've been removing the herniation while you were gone. That is the spinal cord right there. That is the dura on top of the spinal cord. The herniation was literally sitting right in this crater right here, and it's all gone. We've taken it out into multiple pieces. And I had to literally peel back the PLL, posterior ligament. There's another little piece right there. That is amazing. But I had to literally peel back the PLL to get this herniation out. You can see where I cut the PLL over here as well, just to release the edges of the herniation. But it's now in our Petri dish. We have it here on the table. It's pretty much gone. Yep. And you can see the surface of the dura, the surface of the spinal cord right there. Okay, so it's sitting right there like a big round thing. There's another little piece. I'm going to try to get that out. Remember, I don't believe in, there we go, right there. See, that's the last piece that slipped out. Now I can tell you there were about 5 pieces. We're done, yeah. There were about five big pieces of herniation. We got 4 of them out while you guys were watching the video, and then I said, no, we got to come back and show you guys. So we showed you, and that was the last piece, just kind of tucked up underneath the PLL. So the rule here, the thing here that we learned is, number one, this herniation was far worse endoscopically, what we could see, than you could see on the MRI. The MRI shows the spinal cord's getting indented, but the MRI is not the best tool for assessing how bad a herniation is. The endoscope is. But you can't put an endoscope in everybody's neck and in their disc. So you got to use the MRI and hope that it gives you enough information, and you got to put together your experience as a surgeon, knowing what you know, to make the right choice for the patient. Long story short, this endoscopic surgery has shown us the herniation's far worse in real life than it was on the MRI. Now the other thing I want you to know is 95% of herniated discs in the neck, they're subligamentous herniation. That means they don't go past the posterior longitudinal ligament. They're inside the posterior ligament, so you don't have to go through the PLL. But in this case, this herniation went through the PLL and was in the epidural space, pushing on the spinal cord directly. And that's why this patient was having so much problems. Yep. But you couldn't tell that when we were looking at the MRI. It was impossible to tell, but now we can see it. So we've just decompressed the spinal cord, and now we're going to move up to the next level. Shot. All right, I'm going to leave my dilator in. Shot. Shot. Hold on. Shot. Good. Shot. That looks good. Take that. I'm going to put a little pressure. I'm going to show you guys in a minute how small the incision is. It's 4 millimeters. Shot. All right, so I want to keep my dilator here while I'm just applying a little bit of pressure to any veins that might be bleeding. But so far the surgery is going really well for this guy. Shot. So the point I was trying to make with this is, number one, herniated discs are always in multiple pieces. In this case, he had at least 5 pieces that were in the epidural space pushing on the spinal cord. We had to, point number 2, 95% of herniations that are symptomatic are subligamentous. His was through the ligament, so it was epiligamentous, so it was above the ligament in the epidural space. That rarely happens. But looking at his MRI, you never would have guessed that he had a subligamentous herniation. Is that my shot right there? Yeah. All right, so we're going to move to the next level. Up one. Take a look at how small the incision is. Can you guys see this?
Yes.
Yeah. All right, good. No bleeding. All right, let's get a shot. I'm going to come out of the disc space. I'm going to sit on front of the C5, 2, 3, 4, 5. And then I'm going to move up north. Shot. Slip back in. Shot. I need an AP. I'm going to use my x-ray machine to look at the spine and the instrument and make sure my instrument's where it's supposed to be. It looks pretty good. It's coming a little bit towards me, so I'm going to shove it back towards the midline. When I say shove, of course, I'm tongue-in-cheek. All right, lateral, that's good. I gently put it towards the midline. Look at how beautiful this is, folks. No big incision, no scar tissue, no bleeding. That's the beautiful neck right there. We're not destroying anything. We're literally just passing through, like a train passing through at night. Nobody even knows it was there. Shot. It just goes along the tracks, doesn't disturb anything. All right, let's check an AP. Shot. Shot. That's good, lateral. So I've got my dilator where I want it on the AP view, and I've got it. Achoo! Achoo! Oh, excuse me. Right? Now you know what happens when a surgeon has to sneeze in the operating room. All right. Lateral. So I'm happy with my AP. I'm happy with my lateral. Time to go in and get this disc fixed. Shot. Starting to enter. I can feel the fibers spreading. Let's just get one more AP to make sure. Always want to double check everything when it comes to spine surgery. Neurosurgeons are very much the type that like to double and triple check everything. Shot. Yeah, that's it. What do they say? Measure 3 times, cut once? That's me. Oh, it's... I was joking. It's measure twice, cut once, but I do measure 3 times. As a surgeon, you got to measure about 5 times and then cut once. Shot? You want to be 1,000% sure. Hey, I got you to laugh. That's all that matters. Shot? And I got the point across. You don't do what? Shot? See. I got it. At least I'm not that old. I don't need help getting it in the hole. All right? Someday maybe I'll ask you, but not today. Shot? All right, so at this point, everyone agrees we're at the right disc. 2, 3, 4, 5. And we're in the right place, and we're just going to advance this. All right, perfect. Next, I'm going to bring our tube down. Remember, we did the last disc right through the same tube. And I'm going to slide that down. And what you're watching, Shot, is something called endoscopic spine surgery. Endoscopic spine surgery really started in the United States, in Philadelphia, Pittsburgh, with a surgeon by the name of Parvis Camden. And he started it with the safer, easier part of the spine to fix, which is, of course, the lower back, lumbar. And he pretty much stuck to the lumbar spine, but he taught some surgeons like Dr. Anthony Young, Shot, and the Korean surgeons, and then the Koreans took it and applied it to the cervical spine, the neck, which is what we're doing today. And then I went and learned from the Koreans. So it really started in the United States, in Pittsburgh, then it kind of disseminated around the world a little bit, and then the Koreans expanded to the cervical spine, and then actually I'm the first to do thoracic in the world. And I did that 2.5 years ago, so that was back in 2019. I did the first thoracic endoscopic transforaminal surgery for the herniated disc. And today we've done, I think, 18 thoracics now, right? 18 or 19. We did one the other day, Shot. And I think that was number 19 maybe. Shot. By the way, you can tell there's a tear in the back of this disc. You can see how easily the dilator moves through it. But like I said, this is a smaller herniation than the last one, so it should be quicker and easier to deal with. Ah, look at that. The tube got pushed out by the herniation. That's amazing. So there's a lot of pressure in this disc that's causing my tube to get pushed out. It's so swollen, I can feel it. So I have to go back and reposition it. Shot. Shot. Man, it just shoved that thing way out. Shot. You just have to be really careful around the spinal cord. All right, this time I'm not going to take my hand off of it. All right, just stay there. Hold on. I'm going to hold this in. Shot. Yeah, perfect. All right, I'm just going to hold this here until we get everything in position. Great. So everything is going well so far for this patient. We've already done the 5-6 herniation. We're getting ready to do the 4-5. The 4-5 is much smaller. It's an annular tear with a small contained disc herniation. But it needs to be done, otherwise he'll be back again for another surgery. All right, can you hold this, Louise, here? Yeah, you can rest your hand on his chin and just keep it still. And I'll tell you when to move if I need you to move. Where's my laser fiber? There she blows. Any questions from our audience?
Yes. This comes from Flash11923 on YouTube.
Let me see this tube. I got it. Flash 11923 on YouTube. Welcome to our live stream from Deuk Spine.
They ask, this is unbelievable. Why are some doctors hating on this method of treatment? It's amazing.
Yeah, it is incredible. Why are some doctors, I didn't hear what he said.
Why are some doctors hating on this method of treatment?
Oh, because they can't do it. Dude, Flash, it's because they literally can't do the surgery. They don't know how. So, you know how haters are? If they want to do something and they can't do it, they hate. Haters will hate. That's why I broadcast, because it's not about the other surgeons, it's about people. And this is the best surgery for people. So they've got to see it, and they got to know about it. You know, in the end, if they choose to do a fusion, that's their choice. But at least I've done my job of educating people about their options, you know? Yeah. Doctors hate on a surgery they don't know how to do. They hate on a procedure that's so much better than what they've got, you know? Why do people want to see people with good cars like Ferraris crash? Because they just are jealous, you know? I personally don't feel jealous about a Ferrari, somebody with a Ferrari. I'm like, that's good, enjoy it, you know? I'm happy you have that. I don't have a Ferrari, by the way. I don't have a nice car like a Ferrari. I'd love to have a Ferrari someday. But the reality is that I'm happy for the people that have one. But some people just can never be happy for other people. So there's a lot of surgeons that are very jealous. And they're never going to, oh, look at those herniations, man. That's crazy. I didn't expect this much at this disc. This is worse than I thought it would be based on that MRI. I got to say, I'm a bit surprised that there's this much herniation here. I knew there'd be some, but I didn't realize there'd be this much. So I don't know what else to tell you, except that if every spine surgeon in the world knew how to do this, they would be doing it every single day, because it's amazing surgery. And, you know, someday it will be the standard of care, but I got to be honest with you, I can't fix everything in medicine. I can't fix the corruption in the spine world. And that's what needs to be fixed, in my opinion. You got to stop incentivizing doctors to do fusions. Fusions are extremely invasive, but they pay really well. The doctor makes a lot of money with doing a fusion. So, I mean, I used to do fusions, and that's all I did was fusions. I did thousands of fusions. But that's because I didn't have the ability to do this surgery. But once I gained the ability to do this surgery, that's all I do. And I could still do a fusion really well, but, you know, fusions are not good for people. Any other questions? Man, yeah, this is a lot worse than I thought it would be.
No current questions.
Yeah. Wow. I'm actually really glad we got in here and did this. I think he's going to feel a lot better now that we did. So what I'm seeing is on the MRI, honestly, it doesn't look that bad. But I knew there was something wrong here, and I figured we're here, let's fix it. And now that I'm here, I'm like, wow, this is a lot worse. Look at that giant herniation there. You just don't even see that on the MRI. All right, probably 5-10 minutes max.
Okay. Thank you.
We do have a question from YouTube.
Uh-huh.
This comes from Trevor.
Hi, Trevor.
And,
Welcome.
and they asked, what would a 4-level fusion pay a surgeon?
What would a 4-level fusion pay a surgeon? Is that what he asked?
Yes. A 4-level fusion, what would a 4-level fusion pay a
A
surgeon?
4-level fusion on the cervical spine, on the neck, through the front, like this, you know, an ACDF, would pay the surgeon around $20,000. Stand by. And it would pay the hospital somewhere around $150,000. So that's a heck of a lot more than this surgery. This surgery is probably 5 times less. So
For a lumbar fusion is what
a
he replied.
lumbar.
Yeah, he
A
just
lumbar
replied.
fusion, a 4-level, the surgeon will probably make around 20 grand, 25 grand, depends on their contracts, maybe more. That's at a minimum. And then the hospital would get 250,000, $250,000. So you're looking at probably almost 300,000 all in payments. The charges would probably be close to 500,000, $500,000. This surgery, 4-level lumbar, would run maybe 50 or 60 grand versus 500 grand charges and $250,000 paid out, just to give you an idea. The economics. And for a 4-level fusion, Medtronic, the company selling the screws and rods, would make about 30 to 40 grand. Depends on their contract with the hospital. That's assuming cages at every level. Cages are those interbody cages you get with a T-lift or P-lift. So, a lot more money in fusions, guys. A lot more money in fusions. And people don't need them. Take it from a surgeon who does both, endoscopic and fusion. And I was having this conversation earlier with Ron, head of HR. We were talking about some patient that workman's comp insurance didn't want to pay for laser surgery, so they said they'd pay for a fusion instead. And Ron was trying to figure out why, because fusions are so much more expensive. So it's kind of silly, insurance companies, but I think I understand why. They really just want people to not have any surgery. And most people are so afraid of fusion they won't get it done if that's their only choice. So that's why they don't want the laser around, because the laser is going to actually, everyone's going to get it done.
And return to work is much
And return to work is better too with laser, yeah. Insurance companies are like a buffet place, right? They put out a buffet. They want you to come and pay, but they don't want you to eat. Right? Yeah, they want you to come and pay but not eat. Look at that herniation there. That's crazy, huh? Luis, did you expect to see this much? Right? Huh? Yeah. Look at all this. This disc is just crushed. I'm surprised. I really am surprised. All this stuff is herniation. You just don't see it on the MRI. You see a little bit. Right, Henry?
Yeah.
We were looking at this MRI earlier, and I'm like, yeah, it's a small herniation. But it's not so small. Look at all these pieces.
Yeah, you're right.
I mean, this is that one where you look at it and you go, I barely see a herniation there, but it's like a grenade went off in here. Anyway, we'll fix it up. He'll do fine. I'm just glad we did this. Look at that tear in the annulus, just huge. All right, any questions from the audience?
Yes, we have another question from Flash11923. And his question was, once the disc herniation has been debrided, how does the disc reheal itself?
Yeah, good question, Flash. So that white stuff, I'll show you in a second. Right here. See that? Oh, there's a piece of herniation just stuck out right there. You see that? How smooth it is? It's smooth because of the inflammation. All right, you see this white thing right here, right where the laser's touching? That is the annulus fibrosis. It used to be solidly attached across, and it's made out of what's called collagen. Your body makes collagen all the time. Anyway, once I clean this stuff out, it's going to reseal with collagen. It makes its own collagen. It's got little cells called fibroblasts, and they're going to come in there and they're going to clean this thing up and they're going to seal it. They do it. Believe it or not, they do it. This looks like a big wound, right? It looks like a big hole, but it's not. Just remember something. This tube, side to side, left to right, top to bottom, 4 millimeters. It's tiny. So your body's capable of healing things that are 4 millimeters. You know, if you get a stick, something stuck in your body, in your skin, you heal it up in a couple of days. It's closed. Your body can heal this up too. The problem is it can't heal it while this blue stuff's in here. So I got to blast this stuff out of here. That's called the debridement. That's what I discovered years ago. And once I do that, the body will heal. That's all scar tissue right there. So it's looking good. I need about 1 minute. I don't see any more big pieces of herniation. I'm going to go check the other side real quick. We may not need it, but that's fine. Then keep going. Yeah, let's see what this is down here. That's fine. That's fine. No problem. Great questions from the audience, by the way.
No, but we do have a statement from, I believe, one of the patient's loved ones.
Sure.
And this comes from Rock Solid on YouTube. They were like, not a question, but just wanted to thank you for taking care of him. He hasn't been able to live normally for the last year. It would be really good to have him back.
Yeah, thank you. I'm really excited, Rock Solid, to how he's going to be when this is all healed up. So, yeah, definitely a kind of a mess. Worse than we thought based on the MRI, but that's how these things go sometimes. And definitely happy with the way things are going. We've gotten all the herniations out, and it's starting to look really good down here. I think I'm done. The rest will heal itself. He just needs to take it easy. You know, I know how he's going to be. He's going to want to get back to working construction, but you got to talk to him and keep him from re-injuring his disc, all right?
Be careful in the gym.
Be careful in the gym. Be careful at work. You need to give this thing time to seal off. Once it's sealed, it takes about 9 months to a year to fully seal. Then he won't have to worry about re-injuring it. So, all right, we're pretty much done. I don't see anything more. Looking good.
All right, scrub off, lights on, please. Thank you.
All right, good work, everybody. We're gonna put a little antiseptic in, just to, in case, you know, kill any kind of bacteria if there's any in there, which we don't expect, but we do it anyway. Pretty standard stuff. We call it irrigating. I need the light on, guys. Come on. Can't really see. Okay, just irrigating. Now we're pretty much done here. I'm going to show you guys the incision. All right? And it's pretty cool. So, can you guys see this?
Yep.
All right. So we did the whole surgery through this tiny little like metal coffee straw. So all those things you were seeing down there, you were looking through that little tube. And everything looks big because we have a special camera that magnifies it. Long story short, we just took the tube out, and you're going to see the incision. The incision is 4 millimeters, okay? So check it out. Here's a measuring thing.
Yeah, thank you.
Can you guys see all right?
Yeah, we see it.
4 millimeters. Perfect. You guys see that?
Yes.
All right, great job, everybody. A little pressure for 2 minutes, and then we're done. Good work, everyone. Yeah, thanks. So he'll wake him up, and then he can get out of here in an hour. By the way, for those of you watching, you may not know, these are outpatient surgeries. No hospital stay. Everybody goes home an hour after surgery, every single time. We've never had to admit anyone to the hospital or transfer anyone to the hospital. We've never had to keep anybody overnight. It's great anesthesiology, great nursing care, and great surgery. Combination of all three. You need all three, and it's hard to get all three anywhere. All right, no complications. EBL is I'll say 5 drops. And we did the Deuk laser disc repair. Right side. C4-5, 5-6. And for the record, that 4-5 was a lot worse than we thought it would be based on the MRI. Really glad we did it. Otherwise, he'd be back again for another surgery. All right, type your questions up, folks. I'll answer them for you. Just type them in the dialog box. I'll come answer them for you face to face. And also, if you haven't downloaded our app is on the iPhone and on the Android. Go to the App Store, you can download the app. Deuk Spine Institute. It's free. If you know anybody with a back or neck problem, have them send their MRI to us. We do a free MRI review. All right, I'll be there in a few minutes.
I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk Machen here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi. And he came here for the Deuk laser disc repair to be done for a herniated disc on his neck. And he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world has been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well. No problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything's gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen, and there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Deuk Machen. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. And it just took a long time to recover from that. So this was much, much better.
Now, your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations.